Hi all. Today we are going to learn a new topic. It's called migraine. So what is migraine? Migraine is a throbbing pain which is usually felt on one side of the head. It can be moderate or sometimes it can be severe. We also see that migraine is a very common condition which is mostly begins in early adulthood. Some people have symptoms like feeling sick or they have increased sensitivity to light and sound. Okay, there are three types of migraine. One is with aura, the other one without aura, and the third and the last one is migraine with aura and it is without headache, or it's also called as a silent migraine. So what's migraine with aura? Here there are specific warning signs just before the migraine actually begins, like seeing flashing lights. Migraine without aura, the second type, is the common type, and here there are absolutely no specific warning signs. The third one is migraine aura without a headache. It's also called as silent migraine, where an aura or other migraine symptoms are experienced, but you do not have a headache. So the next slide we see, when do we have to see our doctor or GP? We have to see our doctor when we have frequent or severe migraine symptoms, or when the migraine lasts for more than 5 days in a month, even when you try to control it with simple medications like paracetamol or Nurofen. So that's when you need to see your doctor. So next we have a slide which says red flags. So what does this red flag mean? Red flag means that you need to immediately call an ambulance to help you, or you need to take the patient to an A&E. So what are these red flags? First one is paralysis or weakness in one or both of your arms or one side of the face. That's the first one. The second is slurred or very garbled speech when patient is not able to speak. Third is sudden agonizing headache, which results in severe pain. Headache along with a high temperature, stiff neck, mental confusion, seizures, and double vision or a rash. These symptoms suggest there might be an infection, so you need to take the patient to A&E. So that is basically we are trying to tell that it could be a stroke or meningitis, and so the patient needs to be taken to A&E. So either you call an ambulance or take him there directly. So, what are the causes for migraine? The exact cause remains unknown, but however, it could be result of a temporary changes between the chemicals in the nerves and blood vessels of the brain. Also, we see that if there is a relative, that is the familial history, if it is positive, that is you have a close relative who has a migraine, then that could be another cause. Sometimes we also associate them with triggers. Now, what are these triggers? Like tiredness, eating certain food and drinks, stress, or even starting of a period. These are known as triggers and they can cause migraine. So, what are the treatment options? The treatment options include medicines which help to reduce the symptoms. So, firstly, here we have painkillers and triptans and antiemetics. So, painkillers like paracetamol and ibuprofen, we use them for reducing the symptoms. Triptans, they help in reversing the changes in the brain which cause migraines. And sometimes some people do complain of feeling sick and also nauseated. So we prescribe antiemetics to relieve them of these symptoms. So during an attack, some people have also found that sleeping and lying down in a darkened room actually helps reducing the symptoms. So we are at our last slide, which says prevention. We do advise our patients to avoid the triggering agents like it could be stress or any particular food. We also advise them to maintain a healthy lifestyle So what do we mean by a healthy lifestyle? It's just doing your regular exercises and having your healthy meal and also regular at a regular time, staying hydrated, avoiding or even reducing the intake of caffeine and the caffeinated drinks. We also advise the patients to maintain a healthy regular sleep pattern. Sometimes we do note that their symptoms might actually take weeks to show some improvements. That's all for today on the slideshow for migraine. We will see you in another topic. Please do comment on the box below whatever topic you want to hear in my future slides. Until then, have a good day and take care.